In this video, we'll introduce Bordetella pertussis, the cause of whooping cough. Bordetella is a nasty bug with many toxins and virulence factors, so most of our illustration will be dedicated to helping you remember them. The story is about a war hero who's returned home after being wounded and is now staying at a board and care for veterans. The board and care should help you remember Bordetella. So Bordetella is highly contagious and spreads by respiratory droplets. It's able to infect people by attaching to the respiratory epithelium using pili. And once attached, rather than invading, it releases toxins that cause the systemic effects. This pilus has a name, and it's called filamentous hemagglutinin, and antibodies against it help protect against infection. To remember the attachment of this pilus, let's put streamers all over the room at the board and care. These red, white, and blue streamers are definitely appropriate for his welcome home party, and streamers are a symbol we've used many times to represent fimbriae, or pili. Okay, now let's talk about these toxins. I'll start with pertussis toxin, but I'm going to do this a little differently this time, just to mix it up. I'm going to give you the symbols first, then you could try to guess the mechanism of the toxin. So here it goes. First, we'll add a bow tie to the soldier. Then we're going to give him his GI uniform. Now we're drawing a military camp outside. Okay, so you may have very well pieced some of this, if not all of this, together on your own, but let's go over the mechanism symbol by symbol. So the first step in the mechanism is that pertussis toxin ribosylates GI, thus disabling it. So we have our American GI wearing a bow, a symbol that we've used before to mean ribosylation. And when GI is ribosylated, it becomes inhibited, or disabled, which explains why our GI is in a wheelchair. He's a disabled GI, or disabled inhibitory G protein. Since this toxin inhibits an inhibitor, it leads to a rise in CAMP, which we've represented by the army camp outside the window. This is the same way we represented an increase in CAMP in our Vibrio and Bacillus videos. So that's the mechanism of pertussis toxin. And this ADP ribosylation of GI also disables chemokine receptors for lymphocytes, making them unable to enter lymphoid tissue, so they get stuck in the bloodstream, causing massive lymphocytosis. We think a good way to remember lymphocytosis in this drawing is to give our GI a box of popcorn. The white spherical popcorn kernels overflowing the container should make you think of the overabundance of white cells in lymphocytosis. Okay, now let's move on to the next toxin. This is another toxin that increases CAMP levels, but this one does so directly. It does this by acting like an adenylate cyclase, which is why it's called adenylate cyclase toxin. This exotoxin has the exact same mechanism of a toxin we've talked about in a previous video. It's the same as the edema factor in Bacillus anthracis. Remember the Viking tent and the shield with EF carved in it? This was to show that edema factor, or EF, the adenylate cyclase, causes an increase in CAMP. To remember this association, we're just going to take the same EF shield from our Viking video and put it here on the wall of the board and care. A Viking shield would be a pretty cool trophy of war for our war hero. Okay, so we've covered the pertussis toxin and the adenylate cyclase toxin, but we've still got one more toxin to talk about, which is tracheal toxin. There are a lot of toxins, but this one's my favorite. I promise it'll be a breeze to remember. It'll take place outside the window here. Tracheal toxin is part of the peptidoglycan wall of pertussis and damages ciliated cells in the respiratory epithelium. To remember tracheal toxin, we're going to add this tractor, and we'll put him on the path that is midline between these two patches of grass. Just as the path is a midline structure, so is the trachea. And what does our tracheal tractor do? It cleaves long, cilia-like grass, just as the tracheal toxin damages the ciliated epithelium of the respiratory tract. Easy. And that's all the toxins and virulence factors we're going to cover for Bordetella. Let's move on to some of the clinical findings associated with pertussis infection. Pertussis initially presents with nonspecific symptoms. This is called the catarrhal phase, which lasts about 1 to 2 weeks and usually presents with conjunctival injection and lacrimation. Then comes the paroxysmal stage, which can last for 2 weeks or 2 months And this is the stage where patients develop that characteristic cough. It usually happens in children, and it's an intense bout of coughing that gets the child so out of breath that when he does breathe in, it makes this characteristic whooping sound on inspiration. And that's why pertussis earned the name whooping cough. To remember these symptoms, we're going to make our vet here coughing vigorously. And we're going to give him this air horn, one which he might use to call for the nurse. When he squeezes the horn, it makes this loud whoop for whooping cough. Finally, the third phase is the convalescent stage, which lasts up to 3 months, and it consists of a gradual reduction in symptoms. So as you can see, this cough can go on for a very long time. And whooping cough was actually sometimes referred to as the 100-day cough. And I think this is a cool little factoid that can help you remember that these phases can go on for months. So let's draw a banner up here to keep this in mind, and it'll say Victory in the 100 Days War. Okay, let's finish up the story with treatment and prevention. Macrolides are very useful in removing Bordetella from the respiratory tract, but they're not really all that effective in symptom improvement if the toxin's already circulating throughout the body. So it's important to start treatment early. To remember macrolides, we'll include our macrolide crows perched here on the window. Also, notice how this crow is covering his beak. He's doing this to protect himself from the droplets being coughed out by our veteran. This is just a little something we added to signify that pertussis is transmitted by respiratory droplets. Finally, let's finish off with prevention. There are 2 vaccines for Bordetella pertussis, the killed vaccine and the acellular vaccine. However, the killed one's no longer available in the US. We only use the acellular one. The acellular vaccine is composed of purified antigens of the bacteria, and it's a vaccine usually given to children along with diphtheria toxoid and tetanus toxoid. And altogether, this vaccine is called the DTaP vaccine, diphtheria, tetanus, and acellular pertussis. So I think that should help you remember acellular pertussis. But of course, we'll still draw in another memory hook for you. To help you remember the word acellular, we're going to add this old school cell phone sitting next to this vaccine syringe. We made it look like it's from the 90s because back then people actually called them cellular phones, not just cell phones. So the vaccine next to acellular phone should remind you that the vaccine is acellular. You won't hear the term cellular vaccine, only acellular vaccine, so don't worry about confusing the two. Okay, that's all we've got for Bordetella pertussis.